Okay, I think I will now start and stop sharing the document. So we already have a lot of participants with us, and I believe that some more will come. So welcome to the SHARE second webinar, which is entitled Balancing Actions and Long-Term Outcomes During a Time of Crisis. The second webinar is organized again by the SHARE platform. This is the platform dealing with social sciences and humanities research relating to ionizing radiation. The aim of this webinar is to draw additional insight from a wide variety of top experts on issues arising from COVID-19 crisis and which can be also relevant for radiation protection, especially in case of nuclear emergency. My name is Nadja Zeleznik. I'm working for IAMV, which is a technical support organization in Slovenia, and I'm also a member of the Bureau of the SHARE platform. The webinar will have following structure. Each of the speakers will have approximately 5 minutes to present their insight on the topic. We ask them to cover, and in the end, we will have an open discussion with all our panelists. So if you have any questions you would like to ask our speaker, please use the chat function, which is available at the bottom line of Zoom. Tanya Perko will be following the chat and will aggregate, summarize the questions which our speakers will address. The webinar will also be recorded together with your questions, and you will be able to find the records of at the SHARE website. With us are also SHARE President Susan Molino-Hodgson and NERI's President Thierry Schneider, who will close the webinar. The webinar will finish approximately at 4:30. We have around 250 participants from all around the world registered, and thank you for joining the second SHARE webinar. Before we start, I would like to ask all the speakers to shortly introduce themselves, focusing on their background and most important experience. We have a variety of speakers coming from the 6 countries across the world: Germany, UK, Belgium, Norway, Japan, and Slovenia. So I would start according to the order we have in the presentations. So Wolfgang, if you can start this short self-introduction.
Yeah, thank you for Nadja for this invitation and for organizing this workshop. I'm a physicist, as you know, and I'm retired. I work in the field for 45 years, and the priorities of my work have been to accumulate and improve the available scientific evidence and the practical experience about the risks of ionizing and non-ionizing radiation, and to support decision maker and responsible international organizations at various levels to establish and further develop state-of-the-art protective standards. Thank you.
Thank you very much. The second one on our list is Brian Wynne from UK. Please, Brian.
Yeah, thanks, Nadja, and thank you everyone for participating in this webinar. I'm a physicist by long ago training, but spent most of my career in looking at the social construction of scientific and technical expertise in domains like nuclear, but also biotechnology. Coronavirus is a new one for me, as it's new for most of us, but there are certain things that one can say by way of comparison with other issues, including radiation emergencies, which are, I hope, and I believe to be very useful in terms of how we go forward from here. Some analogies from which one can learn, and also I think it's fair to say some past mistakes from which we can also learn. So I'm hoping to be able to share one or two of those with everyone in this webinar.
Thank you very much. The next speaker is Peter Tyson from Belgium. Peter.
Hello, thank you again for the invitation. I'm a social statistician and I'm working mainly on quantitative survey methodology in the field of public opinion and also energy research and risk as reception. I have often collaborated with the National Center for Nuclear Research in Belgium. But my main focus is research in the field of the social sciences.
Thank you very much. And the next speaker is our only female representative here from speakers, Deborah Otten, UK origin, but working in Norway.
Yeah,
Deborah.
thank you, Nadia, and thank you for everybody for participating in this webinar. My background's also science. I currently am director of the Centre for Environmental Radioactivity at the Norwegian University of Life Sciences. But I've been working on ethical issues with radiation protection for nearly 30 years now, and a great interest in all areas of radiation protection, also nuclear emergencies. Also some experience from other areas like nanotechnology, biotechnology, but predominantly nuclear. However, I was asked here today because I also am a member of the UNESCO World Commission for Ethics of Scientific Technology and Scientific Knowledge and Technology. And we recently released a statement on the ethical considerations of COVID-19 that I hope to share a little bit with you later in the webinar. Thank you.
Thank you. Our panelist from Japan is Masaharu Tsubokura. Sorry for a very long introduction, but Masaharu, please.
Thank you, Nadia, and thank you everyone for participating to this webinar. I'm Masaharu Tsubokura. My background is I'm a hematologist, treated a patient with leukemia before the Fukushima accident, which happened 9 years ago. After the Fukushima accident, I went to the coastal area of Fukushima Prefecture and organized the radiation screening program for the public, including the whole body counter screening program, the external radiation screening program. And in addition to that, I summarized the lots of health issues which occurred after the accident among residents, based on the data on my clinical practice. I hope I can share my experience and my thought that I can find a lot of similarities between the two disasters, but some differences between the two. So yeah, I hope I can introduce them. Thank you.
Thank you very much. And our last panelist will be Bojan Žan. Bojan is coming from Slovenia and is also my colleague from physics. Bojan.
Good afternoon to everyone. I'm also, as Nadja said, physicist, but I have 25 years of experience in financial markets, mainly equity markets. I graduated in physics first, then worked as in R&D in physics in laser company, and later switched to financial sector, and I worked on that area from 95. In 2000, I became a member of the board of Pension Fund for Entrepreneurs and Craftsmen. And from 2007, I'm the president of the board and also the president of the subsidiary insurance company. It is a small fund. We have 20,000 members, 200 million assets, and we invest on different financial markets and different financial instruments. And part of my job is also, besides general management, is to also to make investment strategy and investment decisions.
Thank you very much. By the way, in between, Tanya uploaded the link to the web page where Deborah and the colleagues presented the ethics issues in relation to the COVID-19 crisis. So you can copy that and use it later or look at it later. With this, I would like to invite now the panelists to provide the reflection. And Wolfgang, in your reflection, you will focus on similarities between non-radiological consequences of major nuclear accident and non-viral consequences of COVID-19 pandemic. Please, Wolfgang, and I will also project one of your slides.
Yeah, thank you very much. When I was asked by you to give this presentation, I thought, similarities. These two situations are so different, but if you think about it, they have a lot in common. They are high probability, low probability, and high risk situations. And many people think low probability situation will never occur, but they do occur. We have the obligation to do something to protect people if they occur, because they will result in a wide spectrum on very serious risks of the people and of the society at large. This is what we have seen in many accidents in the past. Preparedness for the protection is paramount. And if you're not prepared, you will fail. You will kill people, and you will not do what you are supposed to do to provide help and protection. And there are some key elements, high level, of preparedness, which you have to consider when you do your deliberations. And these are, you have to map and adjust existing protection resources, both technical and personal resources. You have to integrate all of the identified protection needs at all levels of healthcare, including social support networks. And you have to provide training to the key people who have to come into play when these things happen. If you take a decision on protection, this decision has to be justified. It has to do more good than harm, and it has to save lives, not to risk lives. And there are examples where the opposite occurred over the last decades. We have seen after Chernobyl and Fukushima that the impact of non-radiological consequences on public health overweighted the direct radiation-induced health effects. And it is expected that the non-radiological consequences will remain for decades. And I expect that this will also remain for the current situation with the pandemic. So my consequence of all of that is there's an urgent need to develop a science-based communication concept, science-based, not what somebody thinks is right. It has to be science-based, which can be used to help people to better understand the non-viral and non-radiological consequences. And when I say people, I mean my daughter, my neighbor, my minister, the first responder. I mean, there's a wide spectrum of people who have to agree on what we know and what we don't know, and what we do to maintain trust. If everybody is doing what he or she thinks, then trust is lost. And of course, this concept has to be based on solid scientific evidence. And to me, it's very clear, both in the ionizing radiation and in the pandemic situation, we need systematic research to come up with a good basis which we can use to develop these concepts. Thank you.
Thank you very much. Wolfgang, you were even shorter than supposed, but we will ask you more questions.
You would cut me off.
No. We will ask more questions then. And I would like to invite the next speaker, who is Brian. And you will address the effects of processes for public trust or mistrust and impacts on effectiveness or ineffectiveness of scientific authorities in policy arenas involving risk. You propose also to reflect on cases in previous emergency responses where social sciences and humanities were neglected and what needs to be done. Please, Brian, I will now close the share and the floor is yours.
Okay, thank you. And thank you everyone, and including Wolfgang for having started us rolling here. We're asked to compare the ways of balancing short-term or immediate actions in response to emergencies, and in particular to think about radiation emergencies of various kinds, and the coronavirus emergency, which is still unfolding. And the first thing I want to observe, which is actually from my own involvement in analyzing also other industrial accidents such as chemical explosions or accidents at plants where releases have involved emergencies of a public kind off-site, the usual phrase. Now, of course, one immediate comparison between radiation emergencies and indeed, as I mentioned, chemical emergencies as well. But with coronavirus is that the radiation emergencies also, of course, unfold and change. We know that from Chernobyl, where in Britain, back in '86, after the accident became known, and the fallout cloud was moving around over Scandinavia and Western Europe, the British authorities, it could be anticipated, depending on atmospheric movements and so on, it could be anticipated that it was likely to come over Britain at a particular point. And the British authorities estimated the likely outcomes of such a cloud, mainly radiocesium by then, over the UK, that the particular emergency responses should basically be zero. Nothing was required. It was likely to occur in a few days. It was moving over France, Germany, towards the UK and Ireland, and the response was basically, don't panic, of course. Don't bother doing anything about water or food or shelter or anything of any kind, because the radiological consequences for the public at large would be zero. And indeed for any particular community in Britain. That didn't happen. I'm not going to take time describing the details. Many of you will know the details anyway. But the scenario that the UK scientific experts actually outlined proved to be completely false. Not completely false, but in important respects, mistaken. And that, of course, generated huge dimensions of public mistrust in any further scientific and policy announcements that were made after that fact. And that, of course, as Wolfgang has also pointed out, the importance and the fragility of public trust mistrust processes here. It only takes one mistake, one misjudgment, and public mistrust is far easier to destroy than it is to rebuild, as we know, and that's true also in Corona. As things unfold, the emergency is still with us. The emergency wasn't just the immediate effects in Wuhan and around China and then beyond. but the emergency is still unfolding. So, and the point about corona, which is important in respect of those further knock-on consequences and knock-on emergencies in particular parts of the world with particular populations and particular health systems and so on, is that corona is actually a distributed crisis and a distributed set of processes interacting nature and society, and the technical too. It's not either one or the other, and nor indeed are radiation emergencies usually. One might be able to point to dominant causal factors and say physical or human. Think about Fukushima, you could say, well, dominant causal factor, the earthquake under the ocean floor, the tsunami, and the effects on the Fukushima plant. With respect to Chernobyl, you could say something different. Operator, what do we call it, error? Operator experimental experimental practice, what do we call it? But anyway, human factors clearly central in the Fukushima case. Also the reactor design, of course, and. But the point is, there's always that kind of interaction. It's never simply one or the other. And we're seeing that with corona now. And one of my observations about coronavirus, which is important for us to think about and discuss perhaps later on in this webinar, is the way in which the scientific understandings of the crisis, of the virus and its containment processes or lack of containment processes and treatment and so on, is that the scientific advice, in my observation, of course, my observation has been very, very partial. I only speak 2 languages for a start. I certainly don't speak Mandarin or Chinese or any other dialects and languages. So I've not been able to observe and study those kinds of domains. But in my observation, limited though it is, I've seen how the scientific advice is itself, when it's called scientific truth to policy, the scientific advice is manifestly imbued with social assumptions, which are not being recognized and aren't being tested. And there lies a problem in respect of emergency response, particularly with corona, because corona is not just distributed in its character and its consequences, of course, as well, but in its character. It's distributed and it's diverse, and perhaps, we don't know, it's different with respect to different populations. And that's something, one of the many unknowns that still exist here. One of my starting observations was going to be, it now has to be a part of my main presentation here, is that in every emergency that I've ever studied or interviewed the practitioners about and so on, they always recognize after the fact that actually in the immediate aftermath, and I mean immediate aftermath of a crisis, alarms going off, whatever it is, what's going on? What's happening here? Is it a real alarm? Is it a false alarm? First, that needs to be checked. But always practitioners accept after the fact that they did not know what was happening. There had to be analysis, study, monitoring, immediate, of course, to find out what actually was happening. What was the scale, the focus, the cause, the dimensions of the accident and emergency in question, to formulate the response plans and to enact the response plans. So corona here is very different from radiation emergencies in all their variety, and also other emergencies, large-scale emergencies like big chemical plants exploding or releasing toxics into the public off-site domains, often in urban environments, like the Seveso accident in Milan, ironically, given Lombardia's crisis focus as a hotspot in Europe originally, or perhaps still. So I want to make those comparative points because the implicit assumptions that we're often making about the social dimensions, the human factors, how humans will behave, are off to responses. In the case of corona, as I've said, so far, as we've seen, those assumptions remain understudied and actually too crude, very often, too uninformed by existing social science. I'd actually say sometimes not just social science and humanities dimensions, but actually also plain common sense. We often think we need, you know, a sophisticated social science, and we do, surely we do, but we also need plain common sense too, and we shouldn't forget that.
Yeah.
In these processes. I'm stopping there, Nadja. Thank you. I hope we'll be able to return to some of these points.
Thank you very much, Brian. We will move, but later I'm sure you will have the opportunity to elaborate it more on these questions, which are extremely important. Many times officials are using different statistics and interpretation of data to support the measures taken. Peter, you are working with statistics for the social science. Can you provide critical reflection on some wrong use of statistics out of context, meaning of numbers, how inputs define outputs, interpretation of graphs and similar? And I will support you with a PowerPoint you prepared. That's the one.
Okay, thank you once again. I will, in this brief time that I'm allotted, I will cover two main issues. So in this kind of crises and ongoing crises, it's always interesting to see that the big N fetish rules. I will explain this immediately, and how this might misinform the public. And secondly, I will focus on issues involving cross-country comparisons, which are always imminent, and especially also in this crisis, the national context is so crucial. It seems as if the only context that counts is the national context. So let me first move on to the big N fetish, and a very well-known device is the John Hopkins website that probably all of you have consulted. So it's, for me, it's, as a statistician, it's remarkable that the central piece in this website, they're all absolute numbers, and actually since a few weeks there is also a lot of focus on the number of people tested. So and this is especially a focus for the United States and Trump. And for me, this is in a way surprising, because obviously testing, massive testing is a very sensible thing to do, but not blindly. And it seems as if with this kind of devices where they report the number of the big number of cases tested, it seems that the only number that counts is the number of people that are tested. So in the next slide, I will show that this is often a mistake, and many of you will obviously know the difference between sensitivity and specificity. So the sensitivity of a test is a chance that if you're positive, you will be tested positive. Specificity is a chance that if you're negative for COVID-19, you will be tested negatively. But if I'm informed correctly, so most of the tests have a very high specificity, but a rather low sensitivity. This means that if a population is blindly tested, so if someone tries to test the whole population and the prevalence, so the actual number of people that are positive is only 2%, then actually the when someone gets the message, the test points out that you're positive, doesn't say that much, because you will only be actually positive in 60% of the cases. So the general point of this first intervention is, yeah, it only makes sense to massively test if you know where you have to look. And a good example is the German strategy. They have massively tested, but they have also massively tested specific groups. In that case, the probability of being positive, if tested positive, indeed rises to 90%. So it's a big mistake. So that's my first point I wanted to make. It's a business mistake to only focus on the absolute number of people tested. Now, another problem with big N is the total number of deaths that's depicted also on the website. And I come from Belgium, and as maybe some of you know, Belgium is not the number of cases, the number of casualties, deaths in Belgium is rather high. So we have, at the moment, this morning at least, we had 6,200 deaths in a country of 11 million people. So in Iran, for example, they have 5,391 deaths, and that's in a country with 80 million people. So in a way, it seems to make more sense to focus on the case fatality ratio, which you can see on top of the screen. It's actually about 15%. Now, my next point is, yeah, just comparing two countries in terms of case fatality ratio can also be misleading. So, and that's I will show by simple comparison in the next on the next slide. You will see that I compare two countries. So actually, the two countries are pretty similar in terms of the number of COVID infection. Actually, there are 350 infections in each of the two countries. Actually, in country A, 17% of the infected people deceased, while in country B, 22% diseases. So most people will say, yeah, I want to live in country A because there the health system probably is better. But obviously, this is also not necessarily the case. And this I will show on the next slide. So on the next slide, I just split up the population. So I will show it if we focus on the 61 cases that deceased in country A, we simply split them up in terms of patients in retirement homes. So some people in some countries, they just are in retirement homes, and when they deceased, they are not moved to a hospital. So if you press the button, then I can show you this. So the split up. So 61 patients in country A are split up, 25, 20, and 36. So actually, the two subtables on the right hand are just, if you add up all the cell counts, they're just, we haven't lost anyone. But if we focus then on the number of, so actually on the case fatality ratio in each of the subgroups, we see that now the situation has changed. Actually, where we saw in the first slide, on the preceding slide, that country B was performing worst. Now it's changed. Actually, country A is worse. And what's interesting also in terms of hospitalized patients, we see the same picture. So, and this is just a well-known statistical fallacy. It's called the Simpson paradox. If you don't take into account the actual backgrounds of a certain country, you can't make reasonable comparisons. So actually, in country B, there are much more patients that are that live together in retirement homes, while in country A, there are almost none retirement homes. All patients are directly hospitalized. So this is a difference. But if you don't take into account this difference, you don't see the reality. So I want to live in country B because its healthcare is probably better. So these were my two essential statistical points I wanted to point out. But also a third thing which is very interesting if by seeing how national governments and scientists deal with statistics in terms of the corona crisis, there is this clear trade-off between dare to know, sapere aude, and the veil of ignorance. So, and for me, it's always tempting to see we have all this urge to know and to reveal as much knowledge as possible. But obviously, in this crisis, especially this crisis, the corona crisis, where a lot of solidarity between young people and older people is involved, it's quite a challenge. Do we present statistics related to mortality rates in different age groups, or don't we give these statistics? So this is maybe a challenging question that can be dealt with later on. Thank you.
Thank you very much. We can see that statistic is a very tricky thing and can be interpreted in many ways. But we also link to different measures are also ethical aspects. Deborah, you will talk about those aspects and present some experience from both previous nuclear accidents, namely the Chernobyl and Fukushima accident, and COVID-19, especially with focus on the long-term consequences. Please, Deborah.
Okay, thank you, Nadja. I actually think it's rather early to be making any conclusions about long-term consequences of COVID-19, but I find it encouraging that a large number of international organizations have recognized that there are quite serious ethical challenges here. And one of those is the one I've been associated with, COMEST, which is a UNESCO organization. Now, I think the organizers put out a link to that statement if you want to look at it later, but basically it highlights 11 key ethical issues that we need to look at and consider when making any kind of judgments on consequences or policy. It covers things like human dignity, transparency, solidarity, a lot of ethical values that are also familiar for us in evaluation of radiological protection. But I think it also underlines the incredible importance of international collaboration on this, and it recognizes that the World Health Organization actually already in 2016 have published guidance on ethical considerations in dealing with pandemics. Now, just to get you thinking, I've selected just 3 points that I think are worth thinking about and comparing with nuclear emergencies. There are a lot of differences, but there are also some similarities. And for the very first point, I think it's really important actually to acknowledge that there are ethical challenges here. And I think that can't be stated loudly enough. If we recognize the ethical challenges, that will maybe help us at least in a dialogue and a discussion on what they are and how we may be able to address them in the best way. The UNESCO statement really stresses the importance of some sound scientific knowledge, but it also underlines that there are great uncertainties at the moment in that knowledge, and that scientific knowledge, of course, needs to inform policy, but this policy needs to be also guided with ethics. So conclusion for that, the importance of dialogue, the importance of a multidisciplinary approach has been mentioned already by other panelists here. And to finish, nuclear emergencies have also shown that this isn't just a case of health and wealth. There are other aspects that need to be addressed here. So as an example of those, the second point, the statement particularly focuses on consequences for vulnerable individuals and recognizes that these are often, any crisis tends to disproportionately affect the vulnerable members of society. Points raised from COVID are the economic burdens on those short-term contract workers, hardships for children, other people who are already living in situations of domestic instability and at-risk homes, and also sort of a general unfair burden on those who are already living under circumstances of social or psychological stress. So it recommends, well, I mean, these are also very often seen in nuclear emergencies. This disproportionate distribution of risks and benefits have been taken account of. We see impacts on the young, impacts on the elderly. We also have seen and experienced in Chernobyl and Fukushima particular hardships on small scale farming industries and fishing industries and minority populations. So I think any assessment of consequences need also to address these issues, but also think about ways in which we might mitigate consequences for the more vulnerable members of society. And that includes in nuclear emergencies, thinking about to relieve psychological stress for those who may be under anxiety and problems from evacuation, for example, and sheltering. Okay, and the final point I want to make from the statement is linked to a slightly different consideration of potential long-term consequences. And that's the impact of new technologies, and specifically questions that have been raised about the impact of information technology on our so-called surveillance society. And I think key examples from the ongoing crisis is the rapid increase in the availability of mobile apps that have been launched in various countries in different ways to help us manage the crisis. Now, the statement points out that digital technologies, mobile phones, social media, artificial intelligence, all these things can play an important and substantial role in dealing with pandemics. They help us monitor and anticipate and influence the spreading of disease, including with including impacts on human behavior, and also an incredibly valuable source of any kind of data, both scientific data on spreading of disease, but also could provide input in social science following up of impacts. And to conclude, I really believe these technologies are likely to play a role in any management of any future nuclear emergencies. They have benefits and possibilities for empowering populations, use in citizen science projects, for example. But at the moment, there are radiological monitoring apps, and these are almost entirely available from commercial actors. So I think it's really important that we make sure that the ethical, political and social aspects of use of these technologies are adequately addressed. We need to balance issues to do with privacy, human autonomy, against safety and security, and recognize that type of trade-off. And we can come back to this maybe later, but there are already EU projects that look at this. Shamis and Singhs have started to address some of those, both benefits and challenges. And I think COVID-19 really just underlines the importance of having these discussions up front, and that we need to already start addressing not just this aspect of the ethical dimension of the emergency, but all aspects of the ethical challenges of these types of emergencies already now, and having that discussion. So that means we need to recognize the challenges, have a open and transparent dialogue, and be prepared to address what these issues might be. Okay, that's all for now. Thank you.
Thank you very much, Deborah. And for all attendees, participants, there is also a link to the recent report from UNESCO addressing the ethical challenges of the COVID-19, which can be also then summarized for other crises. Our next speaker is Masaharu, as a medical doctor and witness to Fukushima nuclear accident. You intend to discuss the secondary health consequences and social issue after the Fukushima disaster. You also have a supporting slide. Masaharu, please unmute yourself and the floor is yours.
Okay. Thank you very much. I'm a medical doctor, so I would like to briefly introduce what happened after the Fukushima accident. Now, this slide shows the summary of the secondary health issues after the Fukushima accident. The top is, of course, the radiation exposure itself. But in Fukushima, as Wolfgang and Deborah kindly mentioned, the risk of evacuation was huge. For example, 25% of elderly died within 90 days after the evacuation in Fukushima. And the psychological mental health issues are also the huge problem. The lifestyle diseases such as diabetes, the hypertension, hyperlipidemia are also the big issue. You know, the incidence of diabetes went up by 5% in 5 years after the Fukushima accident. So the risk of cancer from diabetes was much higher than the risk of radiation exposure itself in Fukushima. And the fourth point, after the evacuation, the family separated and the local and home environment changed and the younger generation evacuated. So the society got old and the population decreased and the social isolation was accelerated. And in the local area, the supply and demand of the medicine became bad. And we need more nursing care supply, but a lot of hospitals were closed due to the lack of the logistics. So we lost a lot of lives due to the loss of the care to the people. And the final point, we had a lot of the decontamination workers and the new people who came inside the disaster affected area for the recovery. So that we had a lot of new health issues which occurred after the nuclear accident. And of course, the social concern, the media was a problem. So you can see the list of the secondary health issues here. And from the Fukushima experience, one of the lessons was the prioritization. That we can see a lot of health issues, but which is more important than others? So in Fukushima, to be honest, the evacuation was the biggest health issue. But in the COVID, we don't know now for the COVID crisis, but in the future, we have to be prepared for the lot of health issues which occurred due to the countermeasure to the COVID infection prevention. And a lot of health issues which seems to be unrelated to the infectious disease itself. And the second point is the time evolution. For example, people were evacuated and went to the temporary housing. So in the temporary housing, a lot of elderly lost the chance to have exercises and leading to the deterioration of the health. And after the closure of the temporary housing, these people were moved to the new houses again. And again, the society became isolated. So in the long term, we have to have a lot of countermeasures to prevent the central hazard. But every time we take some action, we have side effect. So I don't want to say that to control the COVID is the central, is not the central, sorry. But we have to be prepared to mitigate every countermeasure we are taking now for the infectious control. And in the last point, from the Fukushima experience, I would like to mention the one point. The most important issue is to regain the trust between the government and the people. In the Fukushima case, we had a lot of points where the authority or the government lost the trust from the people. For example, there were the opinion discrepancies between the expert, and sometimes some man show up on the TV and saying something bad. And for example, the compensation issue, the economical impact of the COVID crisis will be huge, so that we need to make the compensation measures, but after the compensation, we will make the difference in the amount of compensation. So this will make the new distrust to the government. If we lost the trust from the people to the government, every countermeasure will not be effective, and the problem will last long. So in my opinion, social science has to make more effort to find a way to regain the trust between the authority and the people to have the better control for the COVID pandemic. Thank you very much.
Thank you very much, Masaharu. And we will move now to the last intervention. The final contribution will reflect the impacts of the crisis on the economy and public well-being, which can be transposed then to some degree also to case of nuclear accident. Wynne, you will have also the PowerPoint presentation just to open it, and you can start.
Yes, thank you. I will try to present the pandemic issue from perspective of financial investor or financial markets. I will first present general logic of financial markets. Then I will show some events in March that led to fall of indexes for 40%. And then show some figures to get idea how big impact on economy this situation is. Pandemic presents major event for financial markets, like for example, nuclear disaster or war or anything like this. Parameters that you must consider are size, duration, how it affects human activities. Everything reflects in economy. And financial markets try to be in advance of economy. They try to anticipate what will happen with the economy. So it's very, the best way to observe what will happen is to observe financial markets. It is not straightforward. There are a lot of parameters that influence situation of financial markets, like for example, general state of economy before the accident, sentiment, media influence, politicians' decisions, and overreaction of markets. Markets are influenced by many different participants, and of course, they are almost never at the right price, but they oscillate around the right price. To maintain stability of economic system, there are two areas that must be under control. This is short-term liquidity, and then the possibility of long-term restructure of economy. Financial and economic system can digest by themselves a limited range of volatility. If volatility is too high, the system collapses. If system collapses, then protective measures cannot be performed. So that is something that economists must deal with when accident of any kind happen. Liquidity is mainly question for central banks, and that second part of restructuring of economy is mainly in responsibility of governments. So if we go through events in March, as you see, I will show you example on a graph of S&P 500 American index, but all the behavior of all financial markets was more or less were more or less the same. So if we see this chart, we see that until quite late in February, nothing happened. Although the information about pandemic was already spread out, and everybody knew that the virus is present in China, but first it was not considered to be a global problem, so markets did not react. Then the virus came in Europe, but it was not considered to be severe, because if you look only at the numbers of pandemic issue and compare them to other numbers, they are maybe not the right way to say it, but they are not so big. So markets did not react. And the first reaction came, but what I must say before continuing, the market was also in a bit unstable situation, because monetary influence from governments was quite high before the event, and the correction was, let's say, we waited for a correction. But what changed the sentiment was the information that there is not enough medical equipment. That completely changed the sentiment, and then the market started to react, and the first fall was anticipated because it turns out that there is a problem. It turns out that there is not enough medical equipment, and it turns out that there will be emotions involved in finding solutions for address the pandemic. The second way, we could say, happened when there was lockdown in Italy, there was travel ban in USA, and so on, and there were no, I would say, big enough financial measures put in place at the same time. Lockdown is definitely a problem for economy. General lockdown is a big problem for economy, so markets started to fall quite rapidly, and then there was still no action from authorities, so markets started to free fall, and then happened all the actions from authorities that were maybe 10 times bigger than few days before, and that stopped the markets, and the markets bounced back and are now in the area of estimation of how will this affect economy on long term. To show some figures how big influence is, if we compare, let's say, with let's look just few figures for Japan, because and to compare Fukushima accident with this one. In this case, we have a forecast for GDP minus 6% and the relief package of $1 trillion US. In case of Fukushima accident, there was impact on GDP around 1% per year, negative, of course, and the whole damage was estimated between 120 up to $300 billion. We see it is 10 times bigger impact on economy than in case of Fukushima accident. If we go further and we compare it with the Great Depression, we are somewhere there. So we expect a drop of GDP for 7%, some even more. We anticipate an unemployment of over 10%. And if we compare it with the numbers from Great Depression, there was a drop of about 8% per year and unemployment up to 25%. So, well, I will conclude. From financial point of view, it is important that whenever such an accident happens, that the liquidity is ensured at the same time that other measures are ensured. Because the problem for financial markets in March is not pandemic itself, it was a lack of liquidity measures that provide liquidity in March. Second, proper communication must be provided, and general lockdown has a major impact on economy, and the question is the pandemic itself at the same scale? So that is something that we will see in the future. Thank you.
Okay, thank you very much. Now we heard all these inputs from our panelists, and we already have some questions. You can see them on the chat, Zoom chat page, but I also received it from Tanya, summarizing, aggregating them. And first one is about the justification. How do we look at justification and optimization of protective measure for a nuclear emergency concurred with the pandemic response when the respective protective measures for each are potentially conflictual? For example, evacuation and gathering in reception center, conflict with self-isolation and separations. Also travel restrictions and similar. Do we have a volunteer to address? Okay, Wolfgang, please unmute yourself.
Okay, I mean, my first response is we will never have one concept and system, because the societies who will apply that are different around the world. And some of the societies accept different risks or approaches than others. This is the first thing. The second thing is we have an almost perfect system of protection with safety standards, requirements, and everything we are discussing here is formulated there at high level. But nobody brings the two societies, radiation protection on one hand, and the social scientists together to discuss that, to come up with solutions. Now, the problem to me is very simple. Radiation protection protects on the basis of numbers. We have reference values. If you approach these reference values or exceed them, then you have to take actions, no matter what it is. And I myself wrote in 109 ICRP, if the dose exceeds 100 millisievert per year, then almost any reaction, including evacuation, is justified. And we have seen there are situations where it's not justified. But to bring these arguments together is not possible if you stick with the same people who formulated that. I have another example, and this is vulnerable groups. The protection in ionizing radiation is based on dose. And this dose is calculated according to ICRP 101 for a standard person. We know that the risk between a child and my age differs by a factor of 10. And people ask, how do you protect my child? And I mean, there's no easy way to change the whole protection system, but we have to have answers to these questions so people will trust us. If we don't have answers, they will turn around and go to somebody else who tells them your child will die. So we need to bring these two communities together, both in discussing these concepts and in doing the research, which then results in, hopefully, concepts, but not uniform. I have seen some questions from Ted and Jacqueline. I mean, it's an illusion that we come up with the same concept in South America, in China, and in Europe. Will not happen. But we have to highlight the key issues which have to be addressed, and then the organizations who are responsible for the protective strategies, they will have to decide and consider what they will use, and it will not be uniform. I mean, near borders, we should do everything that this will be unified, but even, I'm living near the French border, even near borders in Europe where we have the same legislation, the details are different. And I don't think we'll break that up. So we have to focus on the key issues. And the key issues to me are to bring the two communities, radiation protection and the social scientists, together, both in discussions and in research, to come up with something which reflects the values of both communities.
Thank you very much. Anybody would like to add something from the panelists? Or we move to another question? Okay, we move to another question. Another question is linked to the stigma. After Goiânia accident, Chernobyl, Fukushima, and so on, there were some groups of people stigmatized. Do we expect this also in COVID-19? What can we learn from it? How can we protect people from stigmatization and also possible boycott of products which happened for nuclear, which are very relevant for nuclear accidents? Who would like to address this question, this topic, stigmatization? Okay, Deborah, thank you very much.
Yeah, I can try very quickly. I mean, it's very important to recognize that this is a big challenge in nuclear emergencies, and we've seen examples of that. It has been seen in, it depends a lot on the way in which the COVID's been managed. I mean, we've seen in some cases there are issues of stigmatization. I think South Korea had an example of that with the way in which the apps were run and the way in which the societies were followed up. And I think the key thing is try to think about ways in which we can reduce that kind of stigmatization and discrimination, recognize that it can occur, and address ways in which it might be reduced. But the first thing is to recognize it might occur. And just to very quickly follow up on what Wolfgang said, I think part of this is that interdisciplinary discussion that we need to have between social scientists and radiation protection. I might be a little bit more positive because I think that is starting to happen in a lot of countries at the moment, but I don't think it can happen fast enough or yeah, we need to foster that kind of dialogue and discussion.
Peter, you would add? You would add something?
Related to the stigmatization question, this is of course a very important question, and to me it links up with the nationalization of policies and news essentially. I think research has to further establish this, but if you watch the news items in different countries, then there is a clear tendency towards more and more nationalization, national focus. While in the beginning in Europe, there was a lot of attention for Italy as a country where the problems in the beginning, at least in Europe, seems to be the most severe. But after 2 or 3 weeks, in a lot of countries, you see national television only focusing on their own situation, even sometimes on provinces or municipalities. I think from this perspective, it's very crucial that national broadcasters are somehow should focus also on the broader world, and by focusing even more in this period on other countries, I think stigmatization can be limited. And of course, also individual political leaders have a huge responsibility in this. And I think, unfortunately, at this moment, there are some very bad examples in this respect. But we can't do much about this, the last thing. But I think the kind of the national focus, the very specific focus of news broadcasts is a problem. And I agree with the fact that national context is important, but international attention is too.
Thank you very much. We have one set of questions related to trust and conflict. How to address the irrational fear and the emergence of conspiracy theories during a large crisis. We all witnessed that. And how about mistrust by governments and experts over their citizens? We also witnessed that in some countries they are just telling orders. In many they do so, and only in some countries they are more, the government trusts the citizens. What more can we do as social scientists that point out to those and charge that their behaviors that trigger trust or distrust? Do we have panelists to address these questions?
Yeah.
Yes,
I'll have a go. Thanks, Nadja. It's Brian Wynne here. I also noticed some questions in the chat lines about how do we generate or repair mistrust and recreate trust. I think there was a question which was specifically relating to the Japanese context, but it's a more general question than that, really. And I've encountered far too many reports from bodies, often consultants advising this or that policy authority, national or international, where effectively the consultants attempt to actually advise policy bodies or scientific bodies concerned about their own trust with publics or with users of different kinds, where effectively the advice is actually instrumentalizing the relationship between the body which is concerned about its trust level with publics or with users of other kinds and those publics. And so that to me is a direct contradiction of the very idea of trust. The only thing which experts, government policymakers, policy agents of other kinds, the only thing that we can do if we're concerned about trust, our level of trust with whichever audience is out there, is to behave in a trustworthy fashion, not to instrumentalize the relationship by working out how we can manipulate the public into trusting us or whichever other user it might be. And as someone involved in policy, as a scientist, I've seen too much of that instrumentalization, and it's self-defeating, and it deserves to be self-defeating. The relationship is not something that we can control. Maybe we think eventually, when we understand enough about it, we can control the coronavirus. I don't know. But, you know, we shouldn't imagine that relationships of that kind is something which are amenable to control by one party or another. They're specifically not that kind of thing. And we should disavow that whole attempt to instrumentalize in that way. And of course, we can debate what it means to behave in a trustworthy fashion, because that itself is a question. But we can at least, and this is where Deborah's work with UNESCO on the ethics of these things comes in, you know, we can debate, but we have certain principles. For example, we know that if we're actually speaking dishonestly, communicating selectively, then we're likely to deserve mistrust. So there's part of the definition of trustworthy behavior, even if it looks risky behavior in terms of whether they're going to like this, when we tell them something which maybe is not particularly favorable or not particularly nice or easy or anything else. So, you know, we see in the daily practice of coronavirus and the thankfully less than daily practice of radiation emergency practice, we see good examples of good practice. All around, you know, there are examples of good practice, but there are also many examples of bad practice. And we need to begin to systematize that whole process of assessment and evaluation there, and also attempt to improve the learning processes that are going on.
Thank you very much, Brian. I would still like to address, oh, Wolfgang, you want to add? Okay, go ahead.
Yeah, I would like to follow up on that. I mean, at high level, we have many, many excellent papers. But at the ground level, where people do the work in the ministries, in the organization which organize all that, which communicate with these people every day, they don't read these high-level papers. And if they read the high-level papers, sometimes they don't understand what this means. So, I mean, I keep saying for years, we need to translate these high-level things to a spreadsheet or whatever. So people who do the operational world can use it, can understand it, and transfer that in their world. If we stay abstract, we will not change anything. We have to be concrete, specific, and to the world they are living in and they are working in, because they are the ones who communicate. And if they do the wrong thing, then we have mistrust and disbelief and whatever. And so again, social scientists can help to translate these high-level things into a textbook. What are the real questions behind these high-level requirements? Deborah is smiling because she knows that I say that very often.
Thank you. I will still ask two questions to our panelists, which came from the attendees. Masaharu, one is to you. Social support was very important following the Fukushima incident and may also be highly important during lockdown. I wonder what your thoughts are on the different types of support that are optimal. This is from Robin Godwin.
Thank you for the question. In my opinion, every countermeasure, the side effect of the countermeasure will go to the weakest people first. So, I mean, the weak people, poor people, deprived people will be impacted the first, and among the ordinary people, the normal, without any difficulties, the people will feel the problem later. So immediately after we started the lockdown, we have to implement some care program for the weak people, the people with disabilities, people with diseases. For example, in Fukushima case, after the evacuation, the countermeasures to the cancer patient was very important, because the cancer patient lost the opportunity to have a treatment. And if you have some symptoms related to the cancer, maybe you will hesitate to go to the hospital, leading to the delay of the finding of the cancer itself. So in Fukushima for 2 years, the participation rate in the cancer screening program dropped dramatically. That means we lost some chance to have the cancer patient earlier. So the one lesson was that every countermeasure we take has the severe side effect. The side effect will range from very the medical point to the economical other point. We have a lot. Problem will be very diverse. And then, can I answer to the previous question a little bit?
We are a little bit short on time. If you wait and make a final statement and you include
okay.
also this reflection. But a final question for Bojan is one of the attendees asked you, how do you identify the time where markets bottom? Do you see the rise due to fiscal stimulus, a short-term increase, or what?
In general, you cannot. It's very hard to be exact on when the bottom will be. But in this case, it was because the drop of markets was the consequence of the fact that there were no appropriate liquidity measures. You could expect the bounce back when liquidity measures were applied. And the bounce back, which is quite significant at the moment, then it was logical. Now it is the time when all the investors are trying to evaluate long-term impact on economy. It depends on the measures of countries, it depends on financial stimulus, on fiscal stimulus and so on. And now is the time where it's maybe the most uncertain period, and we will see how it will turn out.
Okay, thank you. And now the final question for everybody. What research is needed? Can you propose anything for SHARE to investigate based on your point of view in relation to the COVID crisis and also from your previous experience in relation to the nuclear? We can start with Wolfgang, please.
Well, I think I answered this question already. I mean, to me, the link between the technical radiation protection people, the medical doctors for the pandemic situation, and the social scientists has to be closed. Otherwise, we will not go forward. We will increase our knowledge in radiation protection in details, in medical treatment in detail, and the social scientists will say what they think is right, but we will not come to a joint result. So to me, getting together and defining the priorities within these huge amount of questions which are on the table is a first step, and then work on that.
Yeah. Brian, your reflection?
Yeah, thank you. Could I just use this chance also to say thank you to all of the commentators, to whom we're not doing justice with the variety and interest of their questions, but nevertheless, let's go at the what research question. I guess one of the things which I've been involved with in my research between science and policy, and particularly through risk as a problem and risk assessment as the main mechanism for translating science into policy in many domains. The assumption has been, and it's been criticized thankfully in this discussion here, that too often we refer shorthand to science or social science, and then the implication is that there's a singular. We know very well that neither is, neither natural scientific, medical, biomedical scientific, nor social scientific. None of those domains of expertise, we hope anyway, expertise, none of them are singular. And the problem then becomes, how does science, including social science, inform policy in the best way in a complex issue, whether it's radiation emergency or whether it's coronavirus or any other kind of issue? They're nearly always far more complicated than we could ever possibly trade on a singular imagination of scientific expertise. So then, of course, the issues arise about conflicting perspectives from different experts, and how do we then handle that? Well, one of the ways in which policy makers often respond to that kind of plurality of scientific input or scientific advice is to assume that actually some of these characters, some of these experts are not qualified, they're not properly qualified. We need to go and find the right one amongst all this diversity of the Babel, if you like, of expert input and expert claims. And yes, that might be true in many cases, but in fact, no single expert is qualified. That's our dilemma and our problem in the policy domain, in the domain of practice and response. No single expert body of knowledge is ever going to be adequate. So we've always got to learn how to actually bring together the most relevant and useful bodies of expertise and work out how to synthesize them. That requires policymakers to accept, first of all, accept plurality in expert bodies of knowledge as a legitimate and necessary thing. That's what good research is about. And secondly, it requires us not to be deluded into thinking that there is a singular synthesis across all these different bodies of expertise. But policymakers have to do some work and take some public responsibility for that synthesis. That's always going to be an inadequate, but the best we can kind of synthesis. But it's a policy responsibility, not a scientific responsibility. And too often we find it in the coronavirus almost every day, the policymakers trying to hide behind the scientists. And what's more, the scientists allowing that to happen. When the policymakers make statements that are imbued with hidden social assumptions and commitments, then the scientists should be actually holding their hand up and saying, sorry, but that's not what the science is saying. You're introducing that social assumption or that policy assumption into your version of our science. And the scientists need to be trained how to do that, because they themselves don't see their own social assumptions built into their own scientific advice. There's a big agenda there, and hopefully, slowly, painfully, we'll be able to recognize how to start that process, because it is a matter, we're only at the beginning. We may only be at the beginning of the coronavirus crisis. We're only at the beginning of mutual enlightenment and collective self-enlightenment about how scientific knowledge in all its glorious diversity is actually being used in policy. We're not doing it very well at all. And we've got a long way to climb out of where we are at the moment.
Thank you. This is also the aim of SHARE platform, to find the common solution. I would now like all the others really to make a very short statement, because we are a little bit late and we would like to finish with our chairs present here. So Peter, one statement for the research which is needed.
As I told in my pitch before, I think it's important to know what the effects are of ignorance on trust of the public. So to what extent scientists should sometimes say, I don't know, and to what extent this has beneficial effects on trust levels of the public. Yes, very short.
Thank you. Thank you very much, Deborah.
Oh, come on. Yes. Oh, there are lots of things that could be said. Just to focus on one, recognition that the plurality of voices has already been said, but I think we need to think about the processes by which that is put into place. It's not so much a focus on what the eventual decision is, but to make sure that that decision is made with everybody being given the chance to give an input, and that is a very diverse input from a whole range of different social, scientific, political scientists. So not so much on what the eventual conclusion is, but more focus on how we actually go about making those decisions.
Thank you very much. Masaharu, it's your turn.
Okay. In my opinion, to regain the trust is the most important issue. The trust is tightly associated with the way of the communication. In Fukushima, in my opinion, there are two important ways of communication. The one is communication between the authority and the resident. The second is the communication between the the local expert and the resident. And the third is between the resident and resident. And for example, in Fukushima, I, as a medical doctor, talked with a lot of the residents personally to talk about radiation issues. And I spent a lot of time to talk with them. But I didn't have any logistics. I didn't get any support, good support to do so. So in the long term, the COVID crisis, we need to communicate in the long term. So that to have the best, good solution, that communication is a very important issue.
And Boyan, finally, would you recommend something?
I would say the measures must be synchronized between the areas, economy, radiation, sociological measures, and so on. They must be prepared in advance because these events will happen in the future. And emotional response, non-scientific response must be expected and be incorporated in the plan.
Thank you very much. So I will now give the floor to our present shared chair and the NERI's chair for some final remarks. Please, Susan, and then Thierry, please.
Yeah, okay. Can you see me and hear me okay? Okay, first of all, thank you to all the panelists. I've been making notes throughout the whole discussion and had pulled out a few ideas to summarize, but in fact, the panelists themselves have done a fantastic job at the end of summarizing some of the key challenges for SHARE in the future. Clearly, bringing people together is important. Finding the right processes for bringing people together is important. Questioning assumptions, accepting a plurality of perspectives, including ignorance, which can be changed and evolved, we have to accept there is ignorance. We don't always know the way forward. And being aware that science does not mean a single thing. We have seen that in particular in the UK, where epidemiology is very much driving everything. And the classic for all the physicists out there, actions have consequences. And it seems odd that we're being so reactive, I think, in the COVID situation, because pandemics are planned for. And yet the responses appear to be much more reactive than using any planned responses. So thank you once again. We're going to be holding another seminar in a few weeks. So I'm going to hand over to Thierry as president of NERIS to say a little bit about what the next seminar will be. Thank you.
Okay, so thank you, Susan, and thank you all the panelists for this interesting presentation. I will not summarize anything, just to give you some few points that we discussed together with SHARE platform and NERIS, focusing on emergency and post-accident. It's clear that after the crisis, we will have another phases, and what we learned from Chernobyl and Fukushima is all this question on the transition phase. So the idea will be not in a few weeks from now to summarize or to draw some lessons on the management of the COVID crisis. This is not at all the scope, but we would like to organize together a webinar focusing on the key challenges for managing the transition phase. And then we can base mainly on Chernobyl and Fukushima. What we mean by the transition phase is it was clearly emphasized by several speakers today. After the crisis, this is not the end of the story. And then we may have some long-term consequences. We need to have a lot of decisions. And so we would like to emphasize, first of all, what is the meaning of this transition phase? And we also discussed what will be the long-term situation. Can we come back to a normal situation and so on? The second point is which criteria can be used for the transition phase. how to address that. What are the ethical challenges which are specific to that? What will be the specific issue concerning the decisions which are made and how to respect the dignity of people, their involvement and so on. Another aspect is clearly the stakeholder involvement, which are been largely discussed in radiation protection, and especially this involvement in decision-making process for managing the transition phase. Another issue that we would like to address and which should be of interest also for COVID is the question of long-term vigilance and low dose effect, including the health surveillance. What does it mean? How to improve science on that, how to improve the knowledge, and how to share and to have a joint assessment of the situation. And finally, another topic would be related to the reorganization or restructuration of social and economic activities, which have also been mentioned today, but which are crucial for the transition phase. So we will further discuss how to proceed, and you will be informed briefly if we can organize this webinar in a few weeks from now. So thank you.
Thank you very much. Now I will finish. I would like to thank especially all our speakers for their insights and contribution, and also to all participants showing the interest for these very intriguing topics. We hope that the webinar brought new ideas for research, but also new understanding of interconnection between disciplines. SHARE platform will continue with similar activities also in the future. Follow our website and Twitter for news, and stay healthy and all the best. Goodbye. And a big hug to all.